Good evening, ladies and gentlemen. Welcome again to 103 FM's Men's Healthcare Power. I'm your host, Dennis Webster, and this is our 8th show this evening. What's the show about? Good evening, ladies and gentlemen. Welcome again to 103 FM's Men's Healthcare Power. I'm your host, Dennis Webster, and we're going to be discussing again various men's health issues. The show basically addresses things like prostate cancer, non-cancerous enlargement of the prostate, also known as BPH, and we also try to touch on other health issues, some of them diabetes, hypertension, and things like that. I'd like to keep in mind that I do not make medical diagnosis, and at the beginning of every show, we like to remind you that you should always seek the advice of a physician or other qualified healthcare provider if you have questions regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you've heard on this radio program. There are many who believe that men's health basically affects not just the man, but his partner, children, and the communities they live in. Many are affected by a man's poor health. So what are your feelings about this? I'd like to hear from you. Do you agree with this view? If you would like to be part of this show, I invite you to call us at 628-4103, or you can log on at 103fm.net, or just send us a text at 4103. So the program is focuses men's health. To tell you a little bit about me, I am a registered nurse by profession, trained in oncology. I graduated in 1988 from the Health Sciences Center in Winnipeg, Manitoba, where I started my practice in an area called acute medicine. So what's acute medicine? Well, acute medicine basically deals with, all types of diseases. So it could be anything from lung disease, kidney disease, heart disease, as well as oncology, which is, chemotherapy. My practice on oncology actually started in the area of leukemia. So I did that for approximately 3 years. The Health Sciences Center is an actual teaching and research hospital. So I spent most of my practice in some sort of, teaching and research institution. My practice of oncology actually excelled when I moved to Toronto 3 years later and started at Princess Margaret Hospital in 1991. I started my practice there in an area called bone marrow transplant, basically which is a treatment for people who have blood disorders. Leukemias, some of them are called myelodysplastic disorders, and the focus was basically to destroy diseased bone marrow and give people a whole new marrow from a donor from outside. It's a very difficult area to work in. When transplant works, it works, but when it doesn't, it's a very difficult thing, to look at. If you can imagine an organ transplant, you put an organ in, the organ doesn't work, you can take the organ out. Well, it's a lot different when you're dealing with blood. Once blood is in, you can't actually remove it. So people are either going to do very well or they're going to do very, poorly. So tonight I'd like to review again some of the topics we basically discuss, every week. Prostate cancer. A lot of men are asking me still, and I get a lot of emails regarding, what are the symptoms of prostate cancer? Well, my answer to that is, you're not really wanting to wait until you have symptoms and the symptoms are related to prostate cancer. Usually, at that point, it's prostate cancer that, more than likely has left the prostate. So the key is finding it before it leaves the prostate. This actually gives you the best chance for a cure. So what do doctors normally do and have they been doing for years? Well, they've been doing this blood test called the PSA blood test. We men have a prostate. Women, fortunately don't have one. And this prostate produces something called PSA. Well, the main function of that PSA is to basically liquefy semen and make it easier for the sperm to basically swim and fertilize the egg. That's basically all that PSA does. And for the longest time, it was believed that if a man had a total PSA level of between 0 and 4 nanograms per ml, that it meant that, he was okay and there was no, possibility of prostate cancer being present. Well, we've known from research and we've known for some time that this is not the case. A very close friend of mine who recently had treatment probably about 2 or 3 years ago, his total PSA was 1.9. Now, I've been basically talking about this, week after week after week, and really I've had no feedback, from, any organizations with regard to, what the new standards are. Well, the new standard is something called prostate cancer risk assessment. And if you don't understand what that is, I recommend that you either email me or call me, because it is the standard for checking for aggressive disease, today. We'll be taking a break, and we'll be coming right back. You're listening to 103 FM, the first, the finest. Don't turn that dial.
Well, that's right. We are back here again, and just about 13 minutes after the 9 o'clock mark. I'm here, Rishi Ram with you guys, and Dr. Dennis Webster.
Nurse Dennis Webster.
Nurse Dennis Webster. Mm-hmm. And of course, Nurse Dennis Webster is here with us and to give us some more insight as with regards to men's health. We're focusing on men's health. And I heard in the beginning when you came in, we were talking about, you were talking about prostate and diabetes, and you're talking about, basic men's health.
Yes, correct.
What I want to ask though is that, I'm going to use me.
Oh, absolutely.
Right? Mm-hmm. All right. I'm going to use me because I'm 40 years old and I feel good. I feel okay. I feel all right. Basically, there's no situation where, I require going to a doctor, that sort of a thing. But are there any sort of concerns that, because we in Trinidad, we live a somewhat carefree, frivolous life, so to speak, because we eat anytime we want to.
Mm-hmm. Whatever we want to,
when we want to, how we do basically anything we want to. And only when there's this circumstance, only when there's this need to go to the doctor with regards to, getting some sort of a pain or getting some sort of issue, then you head on to the doctor.
Right.
But men's health basically is that you want to tell us, you know what? These are things that you should do, shouldn't do. These are things that you should look and hear what? These are symptoms that are coming along.
Right.
You look at your basic structure, you look at basic things that are happening, and you hear what? This is things that stuff
little red lights to pay attention
little flags that are coming up right now that hear what? This is things that we got to look for.
Right.
Let's talk about that.
The whole thing about it is, if you're talking about prostate cancer, the red lights that you hope to be, seeing, if you see them, you're going to be seeing them at a late stage. So what's happening right now is they're saying for men who are interested in finding out if they are at risk for the aggressive form of the disease, because not all prostate cancer will cause you a problem in your lifetime. So doctors and researchers today are trying to focus on what we call the aggressive forms of prostate cancer. These are the type of cancers that don't take long to leave the prostate and spread throughout your system. Mm-hmm. So what we've been doing for a long time is what we call, I refer to like the old school medicine, which means you go out for this blood test called the total PSA, which we know does not tell you the true picture, because a man's PSA level could be elevated for many reasons. One of them being non-cancerous enlargement. Sometimes men get problems, with inflammation of the prostate for no given reason. It's called prostatitis. Now, 90% of that prostatitis, no one knows actually what causes it. But we know that if they take a course of antibiotics, a lot of times that helps sort of settle the problem.
But is there some sort of a way to check your prostate?
Right. For checking your prostate, the recommendation these days is that men do something called a risk assessment. Mm-hmm. So what a risk assessment is, it takes the particular formula that they use is called a nomogram. So it's a scientific formula based on information that they know on how prostate cancer behaves. So things like your age. So they know the older you get.
What is that age? What is that age?
So the age...
What is the earliest age that you should go get checked?
Well, the recommendation right now, especially I think according to the Trinidad and Tobago Cancer Society, is they're recommending men start getting checked at age 40.
Okay.
Right. Now if you have a family history, meaning if you have a brother or a father who's been diagnosed with prostate cancer, they recommend that you start at an earlier age, probably around 35, to make sure that you don't have the aggressive form of disease, because family history is a huge, huge risk factor. Now, as I said, age is another risk factor. We know as men get older, the risk for prostate cancer increases. Most prostate cancer is diagnosed in men in their 60s. Now, 60s today is pretty young.
Yeah.
Right? Now, having said that, the life expectancy for a man, I believe, according to the WHO, today in Trinidad and Tobago is like 68. Okay, so we want men to basically start getting checked starting at age 40. Doctors in general don't see a benefit in checking men after, the age of 70. Really, because they say, well, okay, suppose you find cancer, you're already beyond age 70, what are you going to do? Are you going to have aggressive treatment, right? Your life you've already gone beyond your life expectancy.
Yeah.
So what do you want to deal with symptoms? Because treatment is not an innocuous procedure. You are going to get, some sort of side effects and symptoms from it. Your life is really never completely the same as it was before.
What does the whole procedure is like to check?
What it requires basically is, so it's a formula. So you put information into the formula. Some of the information you put in, one piece would be what your age is. The second piece would be what your ethnic background is, because we know black men are at higher risk for getting the disease than, let's say, men of East Indian origin. I mean, they did a study in Trinidad already and the study showed that the rate in men was like 259 per 100,000 compared to like 39 per 100,000 in East Indian men. So we know in the African, in the black population, someone corrected me the other day, he says, well, no, they're not, all from Africa. It's black men. So in black men, you definitely, if your ethnic background is black, you're at increased risk for getting the disease. So definitely you should be checked. If you're black and you have a family history, well, your risk almost, triples. So you should be getting checked. So what's involved is you put the age in, you put ethnicity, we do something called an international prostate symptom score, because men with aggressive prostate cancer have symptoms that kind of mimic enlargement of the prostate, because as the prostate enlarges, it squeezes that passage, which means it prevents urine from coming out. The same thing happens when cancer starts growing into that passage. So you have cancer in your prostate, it starts growing into the passage, so it blocks the flow. So you get symptoms that are kind of similar to urinary symptoms. I think a lot of men are afraid to get checked.
That is an issue
with those symptoms. But what I like to tell them and what I like them to know is, hey, the symptoms may just be a benign situation, because 1/3 of all men will have some symptoms of BPH, or what we call lower urinary tract symptoms. By age 50, at least 1/3 of all men will have some sort of symptoms. So if you're having those symptoms, don't be afraid. Go and get checked. It could be something very benign, something that can be easily taken care of. It's procrastinating that gets into trouble.
Yeah, because that word cancer is the scariest word in the world.
What's the first thing that comes to mind? Oh, God, I'm going to die.
I'm going to die. Yes,
exactly.
Yes, exactly.
Now, prostate cancer in general is a very slow-growing disease. So we know a lot of men are going to die, with prostate cancer than from prostate cancer. So our goal is to focus on the aggressive types. Those are the types that spread like crazy. And one of the areas it spreads to that we are concerned about is to the bones in your spine. Now, if you could think of cancer growing on the bones of your spine and pushing in on your spinal column. So one of the risks is basically lower body paralysis. So you want to save yourself all that hardship. I mean, it costs less basically to find it early than it will cost you if you're waiting till later. So, what we try and do also is we try to encourage the partners of these men to encourage them to get checked. Because, women in general are more proactive about getting their health checked. So we're encouraging women, please,
encourage your husbands.
Yeah, I mean, look, this is a report I read in The Guardian, and this was like from 2013. And it says right here, the highest mortality rate from prostate cancer in the world is in Trinidad and Tobago. Right? Not only that, it's the highest rate of breast cancer in Trinidad and Tobago. And there's some new information coming out now, and I can't actually, put it out now because it's basically headed to the journal, and I will be able to, give the public that information later. Is that there's another type of cancer that's very, very high in Trinidad and Tobago, and basically affecting our younger people. So, I mean, these are areas of concern. Why are we, changing? This is like 2013, so it's 3 years now. They've been saying we need to find the aggressive cancers, right? We need to change what we're doing. Nothing's changed.
Yeah.
So, like, what do we do when people need to start complaining, going to their members of parliament and demanding that we basically put in guidelines of today?
Yeah. Well, it's just about 22 after 9, Nurse Webster. What I'll do,
Dennis, this one, Dennis.
Dennis. What I'll do right now, though, is invite callers. The numbers are 628-4103 to call us.
Absolutely.
And you know what we can do? We can discuss basically anything regarding men's health right now. So,
Absolutely.
guys, you have the opportunity right now to dial 628-4103 and call. And Nurse Dennis here, he will only be too happy to assist with regards to what your issues may entail. All right. So we touched a bit on prostate. What are some of the others? Some of the other issues? Some of the other
issues that men have is, like I mentioned before, the non-cancerous enlargement of the prostate. Now, the prostate grows over time. There's nothing we can do to stop that. They believe it's the conversion of a hormone called testosterone into what we call a high-octane form of testosterone called DHT, and that causes the prostate to grow. So over time, it's going to grow. But not all men with an enlarged prostate will have symptoms of BPH. Okay, but a good number of them, as I say, about 1/3 of all men will have the symptoms. And symptoms like, it could be a storage issue, or it could be a voiding issue, meaning if you're having interruption in your stream. So, sometimes you go and it's, you go to the washroom and it's taking you a long time to get the stream going. So you're waiting. Some men have to push and strain to get, the urine started, right? Well, this is not normal. This is not what happens normally. So, obviously there may be a little problem going on. So it's best to get it checked.
Okay.
Another thing is men getting up a lot at night. Now, that could be related to many issues, right? One being a lot of men drinking a lot of fluid before they go to bed. So one of the recommendations, and it's a lifestyle sort of recommendation, is that you basically not have any extra fluid after you have dinner.
Well, I saw an article yesterday, actually, and I spoke about it on my show yesterday, and it said basically that the ideal time to stop eating before bedtime would be 3 hours before.
Right.
Right? So I'm guessing 3 hours before, that would be stop eating and drinking.
Well, yeah, but and you wonder basically because you have to digest also. A lot of people get this problem also with acid reflux. So you're eating late and then you're rushing to bed, right? So now the acid.
So that's basically if you had maybe a little too much to drink or eat before you go to sleep.
Right.
But that issue where you spoke about that getting up in the night and going to the bathroom a bit too often.
It could be because of an enlarged prostate. Because if you really think about it, what's really happening is when you go to pass your urine, your bladder is not emptying because the prostate is blocking that passage. So you're not emptying completely. So if you think about it, it's not going to take you long again.
Would you know that you're not emptying, or would you would you feel that I'm done?
You feel that you're done. It feels that you're done, because you feel like you get the relief, right? But some men also feel, well, you know what? Boy, it feels like there's still a little bit, left in there. Maybe I'll just stay here a little bit longer. So men actually get that feeling.
But when that feeling does in fact happen, is it that's the red flags there?
Well, it's a red flag, yeah. I mean, you're not emptying completely. I mean, especially you're peeing, you're stopping. You're peeing a little bit more, you're stopping. You're peeing a little bit more. And at some point you get a little bit of relief because your bladder is emptied enough, right? So the brain waits a little while for it to fill up to that point again and tell you, hey, you got to go again.
But how often is too often in the night time?
Well, I mean, 3 to 4 times a night is too much. I mean, because what happens at that point? You're not getting any sleep, right? In the morning you're grumpy because you're not getting enough sleep. So it's impacting really not just on you, it impacts on your family life. When you go to work, you're constantly going to the toilet because it continues sometimes during the day. You're going to a meeting, you can't sit in a meeting because, you don't know if you're going to get you're going to get a call any minute to go to the washroom. Some men don't make it. Some men have accidents. Now, when you're planning to go somewhere, you gotta think, well, okay, it's almost like, when we're going on trips, we plan to, where the gas stations are we going to fill up? Well, almost like you're going out, you got to plan, well, where the toilet is. Because sometimes, it's an urgency you feel, you have to go, you can't hold it.
And of course, at that age, that age that you've been saying over and over, that age 40,
You're starting. This is when you need to start looking.
Yeah.
Right? And we got to look out, after our health because, men's health impacts on the entire family. So.
What about sexually?
Sexual health, that's another issue.
We're not going to get into sexual health just yet. But with regards to your prostate and that issue, would it affect you sexually?
It can. BPH can have an impact on sexual function. Another thing that actually impacts on sexual function is if you've had one episode of not performing to the to what you feel should be the best of your ability. Sometimes that becomes a psychological snowball going down a hill, So, you have a performance issue the first time. It's you make a mental note of it. Well, what are you thinking before, the next time? Is it going to happen again? So we try and ascertain if men are having sexual issues, whether it's psychological or whether it's physical. Another problem is we have high numbers of diabetes in this country. Well, diabetes is probably the number 2 factor with regard to affecting a man's sexual health. So making sure that your blood sugar is in the appropriate level. You're checking things like hemoglobin A1C. You've heard of that? There's different types of blood sugar. There's fasting blood sugar. There's, blood sugars that you take after you eat a meal. And there's something called hemoglobin A1C. And hemoglobin A1C is felt to be the best test to tell you, more accurately, what your blood sugars have been running for the past 3 months.
Well, what we do, we put a pin in that and we'll come back to that in a short bit, right?
Absolutely.
Right now, though, we take a couple messages and we come back and talk some more.
Lovely.
Thanks so much. Yep, we're back here again, and of course, it's all about the Men's Health Clip Hour, and nurse Dennis Webster is with us Tuesdays. Of course, be sure to
every Tuesday 9 to 10.
That's right. That's right. All right. So we're talking about men's health, and we're talking. We spoke of prostate in the first 15 minutes. Then we touched on
we talked about prostate cancer, BPH,
right,
a little bit of sexual health.
And we want to continue along that line right now, and basically touch on issues that affect men.
Right.
All right. So you got into diabetes before there. All right. I had a conversation with somebody not too long ago, and now, like I say, Dennis, is that I'm basically healthy guy in my eyes right now, and the way things are with me right now. I'm basically healthy. Everything is A-okay. No need to go to a doctor or anything like that. But like I say, we live this carefree lifestyle where we eat anything, we do anything we want, anyhow we want, and this is the lifestyle that we live.
Right.
All right. Given the long weekend we just came out of, of course it's anything goes. We eat anything when there's an occasion, Christmas, you name it, Diwali,
party hard,
whatever it may be, we party hard. Alcohol is involved. Everything just goes without any sort of a consideration. Well, you know what? Is it moderation or you know what? Everybody knows.
It's true.
So basically, what he says, the normal thoughts would be that diabetes, it's a hereditary thing. My family doesn't have it, so I don't. There's no need for me to worry. Is that the case though?
No, although there's some link, that diabetes, it does have a hereditary link. It doesn't mean that you cannot develop, especially type 2, diabetes. Obesity is, greatly linked, to diabetes. So, yes, you can. You don't necessarily have to have a family history of diabetes to be diagnosed with diabetes. So it's important that you check, as I say, things like your hemoglobin A1C. And because diabetes is such a big problem in Trinidad and Tobago, you absolutely want to make sure that, you're okay as far as that goes. And the only way is to basically go to the doctor and get checked. It's a blood test, a simple blood test. The hemoglobin A1C doesn't require any fasting or any special preparation, and it'll give you a result. And you want to get a result basically that's less than 7%. So your target goal is less than 7%. Another thing that men need to know also is about some of the medications that they're taking for the diabetes. For example, metformin. Metformin is a very common medication that's given, for diabetes. But if you're going to have a test,
But before we get into medication, all right, before we get into medication, what are some of these symptoms that can tell you, well, here what, it just may be coming on now. You know what? There's this whole, correct me if I'm wrong here now. Most Indian guys always carry this belly in front. Is that something?
Well, I don't know if it's just Indian guys.
Well, that's what I said.
Yeah, it's a lot of guys, a lot of men.
A lot of men.
Yeah, I call it runaway belly, right? So
this is it.
You're trying to catch it to come back. Yeah. But it's a difficult thing, and the thing about it's a difficult thing to lose. But some of the research is saying it's not really all related, to people eating too much.
Okay.
Some people feel that it's a resistance to certain hormones. That causes that extra fat.
Okay, so it is in no way an indicator that diabetes is coming your way pretty soon because of that.
It's a sign that maybe you should get checked, right? And you don't want to be overweight. People should be looking at things like the body mass index, which is a comparison of your height and weight.
Okay.
So you want to keep that into a normal range. So you don't want to be having another thing too. The more body surface area carry. It's more blood. You're going to have to need to pump through all that, tissue and things like that. So keeping yourself, fit in proper, weight, proper weight zone, is a healthy thing to do.
Is there any other symptoms, basically, like,
the
dry mouth thing?
Yeah, you get it, the thirst. You find you're urinating a lot because the body wants to get rid of that extra sugar.
Here comes that urinating a lot again.
Yeah, so that's to say if you're getting up to pee, it could be BPH, but it could also be a symptom of, diabetes, right? So especially if you're not monitoring your sugars, and a lot of men have a family history of diabetes and are still not going to get checked. Right. So what usually happens? Do we wait till we lose limbs, we lose our vision, we get kidney problems. Kidney problems are another big problem in Trinidad and Tobago. So, ounce of prevention. You need to go and get this thing checked and make sure you're in the right zone. And if you're not, and you need some sort of intervention, best to have early intervention or late intervention.
But let's just divert a little bit here. Why do you think men are always so reluctant to go get checked? Why men are always so reluctant to go to that doctor?
I think the general feeling is that men are supposed to be strong, and men shouldn't be getting ill. Right? A man, he's getting ill, he doesn't want to admit because he's the man of the household. He has to be tough and strong, right? When you get an illness, it kind of weakens you a bit. So, those could be some of the, the issues, but, we need to, give them some slack, let them know it is important for them to get checked. If you're ill, it's a family. The family gets involved in this whole problem, right? So if you're ill, your wife's going to want to help you, your children are going to want to help you, your extended family are going to want to help you. So, the whole key is early detection.
How often should this check be done?
Well, normally, for prostate,
prostate, the basic,
at least
the
annually.
basic layout.
At least annually. Annually, we do prostate cancer risk assessments. We do annually, because, like I say, a normal total PSA doesn't mean there's no problem. So don't bank on that. And if we keep at that, reports state that at least 26% of men are not going to be helped at diagnosis. So first of all, let's change the template. Let's get a new foundation, and then we can build from that. But if we keep doing the same thing, the same way all the time, you're going to get the same results. And our results are obviously not improving.
Well, you spoke of metformin. That's some of the medication that can be used. But boy, there is always exercise.
Yeah, you need to have exercise.
Exercise is very important, and it's one that we never seem to have or make the time for.
Regular exercise, absolutely.
Yeah.
But another thing too is, you talk about these men that are carrying on this extra weight. Well, they should be actually checking with a doctor, before starting any exercise routine, because I think, some men have been away from any form of exercise for years and years and years, out of shape, can do a lot of, basically cardio work, right? And they try to do something really, really strenuous, and what happens? You get things like heart attacks. So, I was even looking at the Ministry of Health, the education branch here has a booklet here. It's called Men's Health and Diabetes. It's actually a very good booklet. Quite a few typo errors in there that need to change, but it basically is a great booklet to help you, stay, clear of diabetes.
For me, the minute we speak of exercise, the whole gym issue doesn't really, comes up like that. The first thing we say, well, you know what, we need exercise. I'm feeling a bit sluggish right now.
Right.
The first thing that comes to mind here, what? We're going to go to the savannah and we're going to start walking. Is that always the advisable thing to do?
That's a good start. Walking is always a good start. This way you can tell how much you can actually tolerate comfortably, because you don't want me pushing. You go to a gym class, so, it's happened to me. You have an instructor at the front, real fit.
Yeah.
Going whatever it is. So what you're going to
you're
going to try and keep up to him.
That's it. So
right. So I remember leaving the gym and I could hardly drive home.
Well, that happened to me. That happened to me.
So how is that benefiting me?
That's exactly. So you would advise here what? Go to the savannah and make a few laps and see how you feel.
And try and walk at least 3 times a week. If it's just walking, it's a start.
Okay.
Right. But sitting on the couch, or a lot of people are driving everywhere, so they're not really getting a lot of activity. But the activity needs to be at least 3 times a week. And you want to work up to 30 minutes, but please check with your doctor to make sure it's safe. I lost a friend like that. Didn't do a lot of exercise for a long time, came back, did something really strenuous, was dealing with high blood pressure, basically had a massive heart attack.
Many of us believe that when we exercise, when we walk, for example, or any exercise that we do, we believe that we must in order to know that we have done something, in order to know that we have achieved something, is that we must feel the sweat. We must sweat profusely to know that, what we did, in fact, achieve a good workout.
Yeah.
Is it always the case?
That's not always the case. You see, you may be pushing your heart too much.
Okay.
Right? And, like I say, you only get one chance to make, the mistake. A lot of places actually don't even have those, those cardio converters anymore. So people have heart attacks. There's nothing to basically stimulate their heart to get it going again. So, you have to, the exercise facilities also should be looking at putting those things in place, because people are at risk.
I just got a WhatsApp here from a good friend of mine, and she says, what about yoga?
Excellent for stress, I don't know how much weight, you can actually lose, with yoga, but it's great for relieving stress, stress, the impact of stress on our bodies, right? It impacts on everything, especially, high blood pressure. So, yeah, yoga is a great form of exercise, and I would encourage people. But as I say, first, check to make sure it's okay with your doctor.
Cool.
Okay.
All right. Well, Nurse Webster. Well, I'm continuously saying Nurse Webster. Nurse, that's Dennis.
Dennis is good. Yeah.
Yeah, we're talking about men's health issues and things that affect us on a daily basis. Yeah.
Every day.
And things that we're touching basically is a way of life. Hear what? Exercise. I love it when you said 3 times a week at least. 30 minutes per
You want to work up
workout.
to 30 minutes. You want to work up to 30 minutes. And
Because
people are not going to be able to do that right away, especially if you've been out of it for a while. You may be taxing yourself too much. So you want to work up to 30 minutes a day.
Yeah, many of us also we've got all this equipment at home.
Making good.
Everything I'm talking to you about,
Good furniture.
Everything I'm talking to you about this is experience I'm talking from.
Yeah.
And we have it basically for decorative purposes.
Beautiful.
now.
You dust it nice. It looks nice when you dust it.
Looks nice.
Yeah, but not getting any use.
It's not.
I mean, to me, it just seemed like a very boring sort of activity. Imagine standing in a room just running in one spot all the time, seeing the same, things around you all the time. Wouldn't it be a little bit better to get out, get some fresh air, see some trees, socialize with some people, kick the ball around, maybe play a little cricket or something like that. And when you find that a little bit more, exhilarating, maybe more, enticing than running on one spot all the time. So
Let's touch on another issue. Let's touch on another issue with regarding. Well, we spoke of diabetes just now. Is there another issue with regards to men's health that we need to touch on that you think is important to talk about?
High blood pressure. High blood pressure is another big one. And the thing about high blood pressure is, and I've talked to so many people, and a lot of people are unaware of the importance of taking their high blood pressure medication as prescribed. Some people, I had some conversation with some people, say, well, yeah, I was taking that, but my pressure went down and it's good now. So they stopped taking it. Well, the reason your pressure is down is because you were taking the medication. And what you run a risk of is something called rebound, which means your blood pressure has been running nice and low all the time. Then all of a sudden, boom, it shoots up. Well, the little blood vessels in especially in your brain, can't take that kind of pressure. So it really puts people at risk for things like stroke. So you shouldn't be adjusting any of your medication unless you've actually had a discussion with your family doctor. That's what he's there for, to help you. People sometimes get dose adjustments, but you can't just abruptly stop taking your high blood pressure medication.
Yeah, that's the issue with us,
Yeah.
That's the issue with most
I'm
of us.
good now. You'll be done.
Exactly. Only when you feel, some sort of a pain, only when you feel some sort of a discomfort, then you realize, then you run to go take medication. But and
then you're frustrated because your options are few then. So what is the doctor supposed to offer you at that point? I've been telling you for how many years now, this is what you need to do to protect yourself. You didn't do any of that, and now you're in this situation. So, and sometimes, like I say, especially prostate cancer with the more aggressive diseases, the more aggressive the disease, the fewer your options.
But Ms. Dennis, what you're talking about, you're saying that, you're suggesting basically a constant use of medication. Why must we live that way? Is there any sort of a way that a lifestyle that can be adopted to eradicate the use of medication?
Well, yes, diet is a big factor, right? Because we know a lot of the hypertension is based on changes in the blood vessels.
Because I mean, medication by itself is a real discomfort to be taking medication all the time. You know, so we want to live. Basically, we want to live our life. I don't want to be taking medication.
Free of medication.
Tell me what to do. Tell me what to do to don't have to resort to medication all the time.
Make some lifestyle changes, but you know, Rishi, on that point, for some people, there would be no other option. They have to take the medication. Like, I mean, in the perfect world, we don't want to take any medication. We want to have a great life. We want to be free of all these issues. But, you know, in the imperfect world that we live in, sometimes we have no choice. We need the medications, you know, to keep staying healthy.
Yeah.
Right? To have us feeling good. So we can go out and party, and we can go out and do the things we need to do. But we can make some dietary changes. We can watch our diet. We can watch our activity level by getting in a regular exercise program. So there are some things we can do to maybe for some people they'll be able to get off the medication. Because, I mean, you know, your doctor basically is going to adjust things based on how you're doing.
Yeah.
So if things are great, maybe he can wean you off the medication gradually. But I wouldn't recommend anyone stop abruptly.
Without the consultation of the doctor,
absolutely,
of course.
Absolutely. That's what he's there for.
Because that's basically what would happen to the gentleman, I'm assuming, because he would feel okay. Yeah. And here what? I'm feeling okay. There's no need to continue taking the medication. And that is what's going to happen. That is the danger he's putting himself into. Because the medication, I'm not taking anymore. And then suddenly,
next thing you hear about Jojo boy, he gets a stroke or he gets a heart attack.
Exactly.
Well, yeah. So it's important, you know, to take your medication as prescribed, right? And you should also know, and the doctor should give you an idea of what sort of side effects, you know, to look at. Because, you know, we take medication, and, you know, we always take medication with the intent that it's going to do good for us.
Yeah.
But that's not always the case, right? And you need to know when it's not doing good for you, what sort of symptoms to expect to know that it's not doing good for you. I need to stop. I'll give you an example. One of the treatments of prostate cancer is prostate brachytherapy. So you put seeds in the prostate to kill the cancer where it is. Well, after that procedure is done, one of the drugs we used to give a man is called Peridium. Now, Peridium is a drug to help relieve the discomfort of the urinary tract. But it can cause severe leg cramps, right? So with men who are having severe leg cramps with that particular medication, doctors generally recommend they stop, right? So now if you're not told that when it's prescribed to you, and you start, you know, getting that pain or whatever, you know, you don't know what to do.
Yeah.
Should I continue or whatever? So you need to know these things.
Hey, you know what? We take a couple of messages right now. We take a final break, and when we come back, we talk a little bit about, sexual.
That sounding good.
You know, upliftment.
Yeah, I'm in.
So to speak, no pun intended.
Yeah, with the first and the finest, I'm in.
Let's take some messages. So we're back. Just about 12 minutes to go before the 10 o'clock mark, before we get ready to wrap up here. We're here talking, for those of you now locked in, we're here talking to Nurse Dennis Webster, and he's with us every Tuesday from 9 to 10 talking about men's health. All right, we spoke of a lot of issues. We spoke about a lot of issues that affect men, men's health, and of course, we got one more issue to talk about.
We leave the best for last. Yeah, so I guess the next topic is sexual health, and it's very important. I mean, from young men, you know, to old men. Some men feel, you know, like okay, when I reach 70, everything is over. Well, that's not really the case, and you know, we have a lot of men, you know, who remain active, you know, even after 70. So, I mean, a lot of it depends on, you know, your quality of life, you know, what you've done basically all the years before, you know, to sort of preserve you and keep you well into your 70s. So we talked about some of the things that we need to do. Regular exercise is a biggie, right? We need regular exercise. It makes us feel good, increases our stamina, and it helps generally with sexual health. When you're addressing sexual health, and like I said earlier, what we need to basically differentiate is whether it's a psychological problem or a physical problem. Because like I say, a man sometimes develops a psychological problem from one episode of, you know, lack of performance. I mean, it happens to all of us. You know, you can't be at your best all the time. And, you know, some men basically look at that one episode as, oops, looks like something's going downhill. And then they take that to the next interaction, and then the next interaction, and the next. So it becomes like that snowball going down the hill, getting bigger and bigger and bigger. So we want to first eliminate whether it's a mental issue. After that, we go to a physical issue. So it's, erections in general are all about blood supply. So if you're dealing with, cardiovascular disease, high blood pressure, you're probably dealing with changes in your blood vessels. So as the blood vessels narrow, you're going to have less blood delivery. So what you want to be looking at is basically, keeping your blood pressure in check. Sometimes some of the medications we take for blood pressure can cause erectile dysfunction. So there are some that are more known to be culprits than others. So, if you're on medications for blood pressure and you're having issues with erectile dysfunction, one of the things you'll want to discuss with your doctor is possibly if some of the medications you're taking for your pressure could be causing the erectile dysfunction. Maybe there's something you can change. You can change it to a different one that, has a less of a history of causing that issue.
You're talking about the doctor. You're going to your practitioner.
Your family doctor.
Your family doctor. There's always this issue that, these herb doctors that are around these days, would you advise with that?
See, my training has basically been in a conventional setting. I mean, I'm sure there must be some benefit to the herbs. I mean, most of the conventional drugs come from herbs. The only problem with the herbal forms of products is their lack of basically clinical trials showing what a safe level of the particular ingredient is to be used. Now, in clinical trial settings with conventional medications, we get to test different doses of the drug to see what works best. It's not as stringent, when you're dealing with herbal products. And you have to be very careful also with herbal products because sometimes they mix poorly with your conventional medications. And like I said earlier.
And it could do more damage than
And sometimes you only have to make the mistake once.
Yeah.
And then you don't get to reverse it. And
what about this issue of going and buying the over the counter drug that they help out.
Yeah, but some of them have it's like similar ingredients to the more common ones that we are familiar with. Like Viagra and Cialis and Levitra. Some of them have similar ingredients. But again, I mean, if you're going to be considering those sort of products, check and see the background. Have there been any clinical trials? Like what are the results? How many men? I mean, some clinical trials. I mean, I've seen 2 men.
Would it? Let me ask you a question. Let me ask you a question. Why would it? Would this is supposed to be something natural that should happen with us? All right. But why would a man would decide here what? He needs some sort of a drug to have him go longer, or a drug that will have him perform better. That sort of a thing. That would mean simply that something is wrong with him, that he requires that assistance.
Well, it depends on the man too, right? And why is he thinking he needs the assistance? Like as I say, did he have an episode where he didn't perform as well, and he's worried about that? Because in general, and I worked with some of the leading doctors who treat erectile dysfunction, because we have a lot of men when they get treated for prostate cancer, some of them do develop erectile dysfunction, but a good doctor, a good urologist who specializes in ED will tell you that those erectile dysfunction drugs, generally don't make much of a difference, to a man if he really doesn't have a problem to begin with. So if you think by taking, the Viagra or the Cialis or whatever is going to really make a big improvement in your sexual function, if you don't have a problem, it's really not the case. It doesn't work that way.
So if you don't have a problem, there's no need to go.
Yeah, why, if it's not broken, why
there's no need to go and do that. Yes,
absolutely
I agree. I agree with that.
Absolutely
I agree with that.
Absolutely.
And any other information that we may require?
Well, I think that's basically
some of us who play sports. Hey.
You talked about people bowling and getting struck in the groin and what. Well, like I say, when I did nursing, we had a basic approach, and that was assess, plan, implement, and evaluate. And I think it works that way in general in healthcare. So before you decide on an intervention, make sure you have a proper assessment. A lot of us go to the doctor. I get a lot of emails from men too, and the first question they ask is what I can take. Well, you're almost training the doctors to keep giving you things.
Yeah.
Because sometimes you don't need to take anything. Right? Why do we always feel we have to take something? Why can't we just make a little adjustment in our lifestyle, or in something that we're doing, that, can bring about some sort of improvement. You don't always have to take something. So we need to try and change that mentality that, there's a pill, there's some sort of golden pill out there that's going to cure everything. Like, there's not a pill for everything. right? Sometimes just a little lifestyle adjustment will get you the positive changes you're looking for. So don't be quick to jump on the pill wagon.
Well, I love how you said it off the air a short while ago. All these issues that surrounds men's health. I love it how you summed it up. All right, basically, you need to get checked out.
Absolutely.
Go get your regular checkups. Make sure things are okay. And should the circumstance occur where something might be lurking in the wings,
right,
it can be detected early and sorted out early.
Absolutely.
Early detection is always the way to go.
Absolutely.
Whether it be in a man or woman,
Absolutely, it works the way, for both sexes. It works the same way. Early detection always keeps you ahead of the game.
Early detection, diet, exercise, regular exercise.
And number 1, speaking with your family doctor. Okay, don't worry about the fella down the street who say, well, this worked for me and that worked for me. Well, it may not work for you and it may cause you more harm than good. And as I say, sometimes you only get to make the mistake once.
Yeah, that's a common mistake that happens to most of us. We hear somebody doing something. We hear somebody took something. We hear, there's always that case. And I heard that story so many times with diabetes and so on. People who have diabetes. Hey, you know what? Drink this. Hey, you know what? Do this. Hey, you know what? This is the thing. The hearsay. You know what? What works for Tom may not work for Dick or Harry.
Exactly. And Tom doesn't know your medical history.
That's it.
Your doctor does.
Yeah.
Right? Tom doesn't know you're taking, for example, if you're taking, you want to take Viagra and you're already taking nitrites, well, that could be very unsafe for you, but Tom doesn't know that.
Yeah.
Right? Your doctor does. So always check with your doctor first.
Exactly. That's a real issue that always happens to most of us.
I should say always check with your competent doctor first, because, we have all kinds of doctors in Trinidad and Tobago. They're not all competent, and that's no secret. So ask questions. If something's not clear, ask questions.
Let's elaborate on that a little bit. We got about 3 minutes to go, but let's elaborate on that a little bit. What's a competent doctor?
A competent doctor is someone who is basically aware of the current standards and current guidelines with regard to assessing men and men's health. Basically, someone who's aware, for example, I'll take an example, someone who's aware of risk assessment over the total PSA test. Someone who keeps current. There are only 2 doctors really that I work closely with. And they're very proactive in staying current and doing things that are current. One of my friends was a patient of one of the doctors that I send, men generally to. And as I say, his total PSA was normal, 1.9. So you want to find a doctor who is current with regard to current guidelines for managing men's health. And if you have questions and you don't know any of those, send me an email. Okay,
let's get Nurse Dennis Webster's
so
numbers.
My email is gprl3012@gmail.com. I would also like you to go to the blog that I've created. It's full of information, all free information on different men's health issues, and that's helpatrini.wordpress.com. Again, that's helpatrini.wordpress.com.
We've got 15 seconds. You want to wrap up?
Yeah, you're listening to the first and the finest, and it's been really a joy, Richie, sort of visiting with you today, and I hope to see you back in the studio. Please, gentlemen, go see a doctor. Ladies, please encourage them to do so.
Thank you so much, Dennis Webster. A pleasure indeed. All right. Good evening to you, man.
Good evening, everyone.
Well, this is where we wrap up. Automated programming comes your way right up until 4 a.m. in the morning. Keep it locked in. 103 FM.